I want to share these numbers, most especially for our healthcare workers around the country in the areas most impacted by the coronavirus, so that you know the resources are surging into the hospital systems at the point of the need, and we will continue to do just that. So let me recognize Dr. Birx to reflect on the data and also on maybe some comments on testing. And then Admiral Polovchek, if you just step up, and then you'll describe supplies. We'll hear from Dr. Fauci again and then take a few questions.
Great. Thank you, Mr. Vice President. I don't know if we can get the first slide on cumulative cases. Yes, thank you so much. I wanted to show you a different way of looking at it today. Obviously, we look at case counts per 100,000 Americans in each of our states and metro areas. But I wanted you to see in absolute numbers how much the New York, New Jersey metro area dwarfs all other metro areas. And so you can't even see Chicago, Detroit, or Boston. All of those metro areas are under 25,000 cases. You can see that the New York, New Jersey metro area is about almost 250,000 when you bring those cases together, almost a log more. And that's why you hear us talking a lot about the metro area of New York and New Jersey and the counties of Rockland and Westchester and Suffolk and Nassau and Bergen, New Jersey, and why we're so focused on getting resources to that metro area. If I can see the next slide then. So if I take New York and New Jersey metro area out, this is the other metro areas that we have been tracking very closely. I wanted to show this to you so you could see how those curves are already starting to plateau. So if you look at Detroit, if you look at Philadelphia, if you look at Louisiana, Louisiana's in green, Detroit is in gray. You can see across the board, across these metro areas, would have a higher concentration of individuals. This is what the American people in these large cities have done, where it is more difficult often to socially distance. And we're just really impressed by the work of the mayors and the governors to make this happen. I also wanted you to see this because you can clearly see Chicago and Boston. And so Chicago is in the orange and Boston is in the yellow. They are crossing Detroit. And that's why we have been very much focused on the needs of those areas. And there's one, and Providence is also in that category. It's difficult for you to see them because they're much further down on the slide. But the highest, if you look at the axis on this slide, it's 25,000. The axis on the last slide was 300,000. And so that's why I really want people to understand each of these epidemics, these small epidemics in each of the metro areas, we're tracking independently, as well as any epidemics and outbreaks that are happening in some of our other states. So I just wanted you to have that perspective of how significant the New York, New Jersey issue is and why we've been tracking that so closely. But I also wanted to assure all the other states that we're tracking them also very closely and really working with the governors and mayors. And that's why I wanted to see that not only are the curves flattening in some of those major metropolitan areas, but they're starting to decrease. And this is what we're very excited about. These are cases. We also know that mortality will lag. And so we're really tracking also the number of individuals who have succumbed to the COVID-19. I also wanted to really note here that, yes, our mortality is less when you combine European countries equal to the size of the United States. And I think this is really two things. One, it's the incredible work of the American people, that it's also the incredible work of our healthcare providers and the system of each of these hospitals that have the resources and the ability to respond to the needs of the COVID-19 patients. And I think you can really see this superb healthcare delivery that is happening by the low mortality. Just to mention really quickly about testing, because you've heard me before talk about it, and then it was a little bit misquoted and misaligned, but there are multiple Abbott machines, so I'm going to be very clear, having spent years in the laboratory. The high throughput machines, which are the Roche 6800 and the 8800 on Roche, and the Abbott M2000, these are the machines that run between 500 and 1,000